Good Thursday, everyone, and welcome to this edition of Conversations Daily News. I'm your host, Cyrus Webb. Glad you all could join us once again. We, of course, have your news headlines coming up today. We have the Truth of the Day with Mary Ellen Ciganovich, and today in an Entertainment Spotlight, you being part of my conversation with Rick Dunlop of United Healthcare, talking about Medicare Open Enrollment. Enjoy today's program. For Conversations Daily News, I'm Cyrus Webb with your Thursday headlines. In national news, 1,092 new COVID-19 cases reported in Mississippi, along with 16 additional deaths. The Mississippi State Department of Health reported 1,092 new COVID-19 cases and 16 additional coronavirus-related deaths on Wednesday. 15 of the deaths occurred between November the 2nd and November the 24th, and one occurred on November the 12th. They were identified as being coronavirus-related from death certificate reports. There have now been 145,636 COVID-19 cases in the Magnolia State and 3,745 coronavirus-related deaths since the first COVID-19 case was confirmed in Mississippi on March the 11th. Dr. Thomas Dobb released a tweet that said, "We are entering the holiday season at the cusp of a major surge. Please share these simple guidelines to protect your family. Wear a mask in public. Keep gathering small and within families. If you do get together, do it outdoors. It's much safer." In more national news, President-elect Joe Biden delivers address seeking U.S. unity. In a time of plague and raw division, President-elect Joe Biden appealed for unity on Wednesday in an address to the nation, asking Americans to steel our spines for a fight against the coronavirus that he predicted would continue for months. But even as he implored Americans to join in healing and common purpose, President Donald Trump asserted that the election should be overturned, a futile call, but one that stokes the divisions Biden is trying to overcome. With COVID-19 cases surging nationwide, Biden called on Americans to take precautions to try to stem the tide of the virus by wearing masks and practicing social distancing. He said that he himself was taking precautions around the holiday and eschewing his traditional large family gathering, instead spending the holiday with just his wife, daughter, and son-in-law. "This is the moment when we need to steel our spines, redouble our efforts, and recommit ourselves to this fight," Biden said in remarks in Wilmington on Wednesday afternoon. "We're all in this together." Biden's remarks came as COVID-19 cases are surging nationwide. Hospitalizations, deaths, and the testing positivity rate were also up sharply as the nation approached Thanksgiving, and public health experts have warned that the large family gatherings expected for the holiday are likely to extend and exacerbate the spread. Biden has said turning the tide on the pandemic will be the top priority of his administration once he takes office in January, and he's made multiple public remarks urging Americans to embrace mask wearing and social distancing guidelines to combat the spread. In a related story, Americans risked traveling over Thanksgiving despite warnings. Millions of Americans took to the skies and the highways ahead of Thanksgiving at the risk of pouring gasoline on the coronavirus fire, disregarding increasingly dire warnings that they stay home and limit their holiday gatherings to members of their own household. Those who are flying witnessed a distinctly 2020 landscape at the nation's airports during what is traditionally one of the busiest travel periods of the year. Plexiglass barriers in front of the ID stations, rapid virus testing sites inside terminals, and paperwork asking them to quarantine on arrival at their destination. While the number of Americans traveling by air over the past several days was down dramatically from the same time last year, many pressed ahead with their holiday plans amid skyrocketing deaths, hospitalizations, and confirmed infections around the United States. Some were tired of more than 8 months of social distancing and determined to spend time with loved ones. In business news, picture of U.S. economy is worrisome as virus inflicts damage. Gripped by the accelerating viral outbreak, the U.S. economy is under pressure from persistent layoffs, diminished income, and nervous consumers whose spending is needed to drive a recovery from the pandemic. A flurry of data released on Wednesday suggested that the spread of the virus is intensifying the threats to an economy still struggling to recover from the deep recession that struck in early spring. And finally, in entertainment news, the pandemic is changing Hollywood, maybe forever. No new movies till influenza ends, blared a New York Times headline on October 10, 1918, while the deadly second wave of the Spanish flu was unfolding. A century later, during another pandemic, movies, quotes no longer necessary, are again facing a critical juncture. But it's not because new films haven't been coming out. By streaming services, video on demand, virtual theater, or actual theater, a steady diet of films have been released under COVID-19 every week. The Times has reviewed more than 460 new movies since mid-March. Yet until recently, with only a few exceptions, those haven't been the big-budget spectacles Hollywood runs on. Cyrus Webb, Conversations Daily News. It's now time for the Truth of the Day with Mary Ellen Ciganovich. Enjoy.
Hi, this is Mary Ellen with your Truth of the Day. When you want love, first give love to yourself. It is always nice to be loved by family, friends, or your significant other. And first, you must love yourself. No one else can love you until you love you. Your outer world will always mirror how you feel about yourself. Do you accept yourself just the way you are? Do you take an interest in others? Do you judge other people without even knowing them? Do you have false motives and assumptions you carry through your life experiences? Let go of all these falsehoods. Forgive yourself. Accept yourself. The love you seek is right in front of you. Today, remember, the love you want exists within yourself. Enjoy the day.
Rick Dunlop is my special guest in today's Entertainment Spotlight. Enjoy it right here on Conversations Daily News. For Conversations Daily News, I'm Cyrus Webb with the Entertainment Spotlight. As I've mentioned to you guys before, Medicare open enrollment is ending soon. I talked to Rick Dunlop of United Healthcare about what you all need to know about this open enrollment season. Here's part of our conversation. The annual enrollment deadline is coming up soon, so if you don't mind, let our audience know when the deadline is, Rick, and why it's so important for them to make sure they don't miss it.
Well, that's a great question. The annual open enrollment period extends from October 15th to December the 7th, and so it's that one time each year where Medicare beneficiaries across the United States have an opportunity to kind of tune up their benefits and look for the great new opportunities that are out there and look for those things that are going to match their healthcare goals as well as their financial circumstances. And you know what? If they don't act by December the 7th, they run the risk of being locked into the same plan and benefit design for another year.
Yeah, and that's such a good point. And we've been so pleased to have United Healthcare come on the program and share with us the importance of not only those who are newly looking to enroll, but also those that may have current plans, why they should be able to use this time to be able to look to see if there's a better plan for them. So what are the things that they should be looking out for, Rick, when it comes to considering a Medicare plan for themselves?
Well, I always ask folks to take a deep breath and make a list. You know, what you want to do is make a list of, what your healthcare priorities are, and what that includes is who's your healthcare team. So that would be your primary care physician, the specialists that you see, hospitals that you may access, and pharmacies and such. And then what you want to do is make a list of medications you're currently taking, the things that you might take in the future, and you want to compare that. You want to compare that to your current plan. And even if it's a good match, what you want to do is check the market, and shop around a little bit, because every year plans change. Things get, there's great new options out there that you just really don't want to miss, because you want to make sure that you're maximizing, your expenditure opportunity.
Yeah, really good point. Cyrus Webb, Conversations Daily News. We thank you all for tuning in to this edition of Conversations Daily News. We'll be back with you guys on tomorrow to wrap up this week. Until then, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Daily News today. Make it a great one.